Hi, my name's Dr. Jenny Wakeley. I'm a GP specialising in dermatology and I work on the NHS. I'm here today to talk to you about fungal toenails and how to treat them. They are often spread from foot or hand fungal infections, but they can occur just on its own. They often affect the big toe or the little toe, and they can affect more than one nail. The incidence increases with age and also associated with other nail problems such as psoriasis. So how they present is they can present as a whitish, yellowish, opaque streak on part of the nail. They can present with the nail becoming thicker or crumbly. Sometimes you get some sort of cheesy looking crumble stuff on the underside of the nail. They can get thickened. The top of the nail can peel off. You can get little pits in the nail. You can get little yellow spots in the half moon of the nail. Sometimes things that can look very similar to a nail fungus are aging, what we call hypertrophic or thickened nails, or psoriasis nails, and also thickened nails because of medication such as Roaccutane. So the best way of diagnosing a nail fungal infection is to soak the toenails to make it nice and soft and take off the top of the nail with a little bit of the cheesy crumbly stuff underneath as well. So you probably need to go to your GP initially and get the various forms and the container to put it in, and the GP can send it off to the lab. And it takes about between 2 to 5 days for the results to come back. However, even if the results are negative, doesn't mean to say that it isn't a nail infection. It is worth pursuing before treatment if you can. On the other hand, if it shows a fungal infection, I'll go on to treatment in a minute, but if it doesn't get better with treatment, it might be that you've got, two different things going on. So if you're an older person, if you've had repeated trauma to the nail, if you've got psoriasis, then the nail may not go back to its original state because of the other underlying nail changes. That treatment involves either an antifungal tablet or an antifungal nail lacquer. So if there's less than 80% of nail affected and there's 1 to 2 nails affected, then it might respond to the nail lacquer called Loceril. You put that on once a day. The nail lacquer usually takes between 6 and 12 months to have any effect. So if that doesn't have any effect, then you might want to use an antifungal tablet. Even so, you probably need to use it for about 4 to 6 months maximum. And you need to wait for, how you know that to stop treatment is you wait for the top third of the nail to be affected. So the bottom 2/3 are normal, and then you can stop the treatment. If you're using it for several months, your GP will probably get you to do some liver function tests, because very, very, very rarely it can react with the liver, which is why, unless we really have to, we try not to use tablets. For example, if the patient is quite elderly, they're not tolerating the tablets very well. If they're pregnant, then we try not to use the tablets because very rarely the side effects can be quite harmful. So I hope this has been helpful in treating fungal nail infections, and thank you for listening.